Today's webinar is titled Predators in EMS, Identifying and Addressing Harmful Behaviors, presented by Dr. Carlene Thornton. I'm going to pass over now to our speaker. Dr. Thornton, thank you so much for being here with us today to share your knowledge and experience with us, and we look forward to the presentation.
Thank you, Rio, and I am happy to be here. And thank you to everyone for joining. As we all know, and just your presence here shows how important this topic is. And we all consider ourselves professional, and we constantly talk about modeling the behavior and advocating for our students and creating a conducive learning environment. However, what do we do when things go awry? What do we do when we see things that we believe are inappropriate or that we know are inappropriate? And that's something for us to consider. And unfortunately, there are predators in EMS. There are predators in the classroom. There are predators in the back of the ambulances and on the fire engines. So we have to really take a serious look at identifying harmful behaviors and inappropriate behaviors and addressing them sooner rather than later. So, as Rio mentioned, the title of this presentation is Predators in EMS, Identifying and Addressing Harmful Behaviors. Because if we see these harmful behaviors, we know that they're inappropriate, and we remain silent, then that's just no good. So we have to identify and address the harmful behaviors, and we will cover a few methods that we can use to address these harmful behaviors. And again, I am Dr. Carlene Thornton, and I am delighted to be here. There are no conflict of interest as it relates to me and anything in the presentation. I am not selling any products. I am not presenting anything for you to go buy. I will share a couple resources and which are free of charge, just for us to be better prepared to identify and address harmful behaviors as it relates to predators in EMS. So with that, we are going to continue on. So, and the latest data that was available is from 2023. And in 2023, over 350 were arrested for sexual misconduct related incidents. Now, that does not include just reports. How many were reported? These are actual arrests, and arrests based on the evidence that was presented, that we had over 350 educators arrested in 2023 for sexual misconduct. And when I searched as early as this morning to see if the numbers for 2024 were already out, and I was not able to find any solid numbers. There were many cases that came up, including cases in 2025 of misconducts by educators. One of the things that I think is important to remember as we think about sexual misconduct and inappropriate acts, a lot of times the thought is male on female students, and that's not the case. We have same sex, we have male on female, we have females as the perpetrators as well as males as the perpetrators. So we have to keep an open eye and view inappropriate conduct through a clear lens so that we are aware, regardless of who the perpetrator is and who the victim is, because males can be victimized as well. And that's something that is often missed or confused or just overlooked. One of the things, as Rio mentioned, is that if you have questions, please put them in the chat. If you put them in the chat, Rio, let me know that we have a question, and there will be a period at the end for you to ask questions as well. But during this presentation, I would definitely prefer you to ask questions as we go so we can address it while we are on that topic. So let me go back before I start. So I need to create this scene for you. Imagine that you are in class, whether you're a student or an educator, you are in class and you witness an instructor say something to a student that is inappropriate. There is a classroom full of people and the situation comes up. And now we're going to talk about the incident, but put yourself in the mindset that you're actually in a classroom. Now, you're in this classroom and the educator says to a student, I want to put icing all over you. When you hear that as an educator, what would you do? And feel free to type it in the chat now, and Rio can share some of your comments if I'm not able to see them. But if in Rio, does anyone have the ability to come off of mute?
Unfortunately, not at this time.
Okay. So that's fine. So if you have a comment, just put your comment in the chat. So this is what the instructor says, is I want to put icing all over you. Then he proceeds to stick 3 fingers in his mouth and lick them and make moaning and groaning sounds while staring at the student. After saying, I want to put icing all over you, what would you do as an educator? Would you step in and say something? Now, this is somebody that's trained you. You've known them your entire career. They were your trainer. What would you do? Would you have the courage to speak up? And if you're hesitant to speak up because this person is someone that you respected, this is someone that has trained you, would you be comfortable enough to speak up? And if you're not comfortable enough to speak up, what do you think a student who's just starting out, who is in recruit school, who is an EMT student that's at your technical college, and they've only been in class for maybe a month, that this is their first real job? They need to earn a living to take care of themselves, to help support their family. Imagine how that student would feel, but more so imagine what would you do? What would you do? Even if you were a student, would you be courageous enough to speak out? As an educator, another adult in that room, another educator, a professional in that room, what would you do? Unfortunately, a lot of us remain silent, and silence is consent. If you do not speak up and say that this is wrong, this should not go on, what message are you sending to the perpetrator? Unfortunately, you're sending a message that what they're doing is okay. If you do not speak up and say, no, stop, this is wrong, what are you doing? Call them out on it or ask them to step outside of the room and you take over. Whatever the case may be, if you fail to speak up, you're sending the message to the perpetrator that it's okay. And what's going to happen is that behavior is going to continue and it's going to get progressively worse. And in that case that was just mentioned, that's exactly what happened. This person has been doing it for decades and he's been getting a pass. And people have been excusing his inappropriate behavior, making excuses. Oh, that's just him. That's just the way he is. And it continued so much so to where that educator got to the point to where he felt emboldened enough to do it in a classroom full of recruits. In a classroom full of recruits, he said and did the things on the screen in front of witnesses. But because he had been protected for so long, and he's known to have said, nothing's going to happen to me. You can complain, but nothing is going to happen to me. For decades, this has been going on. So what I do is encourage you to speak up. If you see it and it's inappropriate, say something. Do not remain silent. Do not remain silent. Be courageous enough to speak up and advocate for your students. Advocate for the new professionals, those that are just learning their way. And some of them are very young adults that are entering the workforce for the first time. Speak up for them. Think about people you care about. Would you want someone to speak up for your daughter, for your son, for your spouse, aunts, uncles, grandmothers, parents? Would you want someone to speak up for them, nieces and nephews? Or would you want someone that knows better to sit in silence? So we have to be courageous enough to speak up because silence is consent. And what I encourage is that we be upstanders. And what upstanders are individuals that will speak up, whether they are advocating for themselves or someone else, they speak up and they say, this is not right. This is not okay. And there are several different models that you can use to be an upstander, whether you're using CUS or whether you're using the 5Ds. There are many different frameworks that you can use to be an upstander. And the 5Ds are direct, delegate, distract, document, and delay. And those are the 5Ds. Are we going to be direct? Stop, this is inappropriate, it should not go on? Are we going to delegate the authority and say, hey, go get someone and bring someone else in to talk to this person because maybe we're not comfortable? Are we going to distract them and change the topic or go somewhere else? We definitely have to document. And if we can delay an encounter or an escalation, then that's what we need to do. Now, what is predatory behavior? That is something that we definitely have to think about and consider is understanding what predatory behavior is. So manipulation, they are manipulating the facts, they're manipulating the situation or manipulating the environment where don't believe your eyes. What you're seeing is not really what it is, or they disguise it, right? And they manipulate a vulnerable person, and that's their target, someone that they feel is not credible or that they won't listen to them. Who's going to take a recruit word over mine? And I've trained all the people that are investigating. I've given them their certification. I signed off on their CPR card, even though they didn't take CPR. I've done this. So I'm going to manipulate the situation to where one, I'm going to manipulate the individual, the would-be victim, to come into this private area because I need to help you. I need to show you. And they exploit the most vulnerable, definitely an abuse of power. They're not respecting normal boundaries. Some people may have boundaries that may be a little extreme or outside the norm, but they're not respecting what would be considered socialized normal boundaries, and they're violating those boundaries. They're doing things that anyone that sees it knows is inappropriate. Oftentimes, the inappropriate behavior starts very subtle and then it gets progressively worse, where they'll start with something mild, where it may be a touch on the shoulder, and it may progress to a back rub or shoulder rub, and then the next thing you know, the hands going all down the back and inappropriate, or even down the front. So start subtle to see if they can get away with the slight, gentle touch before they progress into something even more egregious. So, what is grooming behavior? So, grooming behavior is when the predator identifies their target. Once they identify their target, then the behaviors start. Let me test the waters. Let me see what I can do, what I can get away with. Let me understand their network so that way I'll know who they're talking to. Do they have a support system? Or are they truly all alone to where I can take advantage of them and not have to worry about repercussions? I don't have to worry about anything coming back on me. Or they've already established a pattern based on their history or background, or even the demographics they fall within, to where the predator feels that they are more trustworthy and their word will be believed over that of the victim. So they identify their target, and they hone in on that target. So they've identified the target, and then they start paying excessive, unnecessary, unwarranted attention to where even if it's in a class and a scenario is going on or there's group work, and this instructor always goes to the student to see if they're okay, to see if they need any help. And of course, well, I was just offering help. I was just offering my assistant. But why are you singling this student out that seems to be doing well or seem to be doing okay, but you're singling them out for this attention? You are paying unnecessary attention to them. And the words may be, let me help you. Let me show you. Are you okay? Are you comfortable? How are you feeling today? And it's not going to the whole class. How's everybody doing today? What did you do this weekend? How's everything going? Good. Or even the one-on-one casual conversations that may take place with various students. It's always this one student that's getting excessive attention, whether it's positive to build them up, or it may be a little critical. Well, you have a speck of dust on your shoes, or why are your pants like that? One pant leg look a little longer than the other. What's going on there? Or finding something to pick with the student about, even if it's not major. And then they'll pass it off as, oh, I was just joking. Oh, I was just playing. Oh, ha, ha, ha. No, it's not fun and games if the attention is bothersome, unwanted, and unnecessary. So excessive attention is outside the norm. And from showing excessive attention, your shoes always have these spots on them. Come here in my office. Let me show you how to shine your shoes. Or come, let me tutor you. Let me help you. So the victim is starting to be isolated, separated from the group, separated from the pack for whatever reason. And then they're testing the boundaries with the students, whether it's a type conversation where it goes from, hey, how are you doing, to asking explicit questions about their relationships. Are you involved with anybody? Are you dating anybody? Are you sexually active? Just to be as blunt as that. And some predators do that when they've gotten to the point to where they've been protected for so long and other people are covering up for them, or that they are aware that their behavior is being accepted as, oh, that's just the way they are. Then when they test the boundaries, it starts subtle. But then even a question of, oh, are you dating somebody? Well, the student complains, well, I was just asking if they dated someone, so that way I could say that you could use your partner to do your patient assessment. And they're going to have a way to bring it back around to make it seem as if the student is exaggerating or acting outside of the norm versus your behavior is inappropriate. And if other educators in the room are not speaking up and saying this is inappropriate, stop it, don't do it, or hey, what are you doing? What's going on here? Then again, that silence is sending a message that their inappropriate behavior is okay. And we just can't allow that. So, from testing the boundaries with that individual, they're also testing the boundaries with you, their coworkers, their colleagues, because they're seeing, what are you going to do? When they ask the student, do you live alone? What does that have to do with EMS education? Absolutely nothing. And to say, well, I just wanted to know if they had people at home that could help them study or that could help them do their patient assessment. You can get a doll baby to do patient assessment. You could get a stuffed animal to do patient assessment. So they'll have an excuse, but they will test the boundaries, not only with the victim, but with their colleagues and coworkers as well. So be mindful and look out, and they're seeing and they're testing you to see if you're going to stand up, if you're going to stop them, or if you're going to excuse it. Or even worse, not only are you not saying anything, but are you going to leave the room to allow them to do whatever they want to do uninterrupted? They're testing your boundaries just as well as they're testing their victims' boundaries as well. Then they create the environment where you're sworn to secrecy now. And hey, I want to tell you a secret. And it's personal. And they'll share something personal with you. They'll share something personal with the student and get the student to share something personal with them. And of course, when the story is told, it's not that this is what I was doing. Is well, the student was talking to me about their personal life and they were telling me about all of this stuff that's inappropriate. And so we were just talking, but they came to me, they initiated it. I've been doing this for 30 years, 40 years, even 20 years. And I've never had this happen. Well, is it because it's not because you haven't been doing it, it's because it's been covered up or that your colleagues are in cahoots with you and allowing you to continue this inappropriate behavior. Also consider this. When they test the boundaries with you as a colleague and they're creating this environment of secrecy, are they offering to do things for you that are inappropriate? I'll put you on my CPR roster. I'll put you on my ACLS roster because I know you need class. I know you weren't in there teaching with me, but I'll put you on the roster with me. And I got you, don't worry about it until the tables turn to where you see them doing something inappropriate. And now they have something to use against you to keep you from being speaking out or speaking out against them. I gave you your CPR card. I gave you overtime. I let you sign this roster. You haven't attended a continuing education class in 2 years, but I always take care of you. So they create this environment to where I'm looking out for you. I'm taking care of you. So now you feel beholden to them to where you can't speak out because they've falsified documentation on your behalf, because they've given you certifications or credentials that you didn't earn. So they've done these things for you. So now they have you boxed in. What are you going to do? Are you going to risk exposing yourself that you have credentials that you didn't earn? Or are you going to keep quiet and allow them to continue this inappropriate behavior with students? So all offers of gifts aren't really good gifts. They could be a setup to create a situation to now you can't speak out against them. You are sworn to secrecy. You can't speak out against them without jeopardizing yourself or your career. And that's the environment that they're creating for you. And at that point, you have to decide, is it more important for you to keep these certifications or to allow someone to be victimized? What type person are you going to be? What type adult are you going to be? Are you going to be an upstander? Are you going to be a decent human being? Or are you going to be out for self? Or are you going to advocate and protect those that we are sworn to protect? What are you going to do? So when people are offering to allow you to sign in for classes you didn't attend and put your name on rosters and do all of these things that you didn't earn, what are they setting you up for? And I am not saying don't trust those you work with, but be mindful. But if you earn your credentials and you know you've earned them, then they can't box you in. They can't swear you to secrecy for something that you know is inappropriate and needs to stop. But when you allow them to pencil it, when you allow them to sign your name, which is fraud and falsifying documentation, when you allow them to do that, what else are you allowing them to do? Because you put yourself in a bad situation thinking they were offering help while the whole time they were preparing the environment to where you would be silent and you couldn't expose them without exposing yourself. And this predatory behavior is dangerous because it creates an environment because there is a progression, but they can oftentimes disguise what they're doing as attempts to help, whether they're helping you or they're being a mentor, I'm just guiding. That's why I'm having these one-on-one meetings with this student. It's because I'm mentoring them. New students, new recruits, new employees. They're just getting this job. They're afraid of losing their job. They are afraid of speaking out against someone that is considered well respected, someone that, oh, everybody knows, someone that they've heard so many people say so many great things about this person. So who am I? I'm just starting. Nobody knows me. And the victim feels that their voice is not strong enough, is not powerful enough, that who is going to believe me? And if I speak up, will I lose my job? Will I be retaliated against? What's going to happen to me if I speak up? Well, he said that he was only trying to help me, but he offered me alcoholic beverages, or he offered me to take this pill, or he said I was stressed and I looked like I needed to relax, which I was because I have test taking anxiety, or I have whatever issue. And he just offered me a massage, but then he wanted me to take my shirt off. He offered to tutor me because I wasn't doing very well on my test. So I agreed to meet him after class, and everybody was gone. So that's why it's dangerous, because it can be hidden, it can be concealed. The victims are afraid and confused, and it does get progressively worse because once you sit silent and you don't speak up after the first incident or the second incident or even the third incident, or it's gone on for a couple weeks, and then you speak up a month later or 2 months later, or it's not the first through the third time, but it's the seventh or the eighth time that you decide to speak up, who's going to believe you? What am I going to do? Are they going to blame me as a victim because I didn't speak up? Even though I wasn't sure of exactly what was going on, I didn't know who to go to, I didn't know who to talk to, I did not know what to do. So now what's going to happen? But because it's often disguised as mentorship, because the victim is afraid and confused, and because there is a progression and it escalates over time, it may be a week or two or three between the first incident and the second incident. So because that escalation occurs over time, it allows for patterns to go undetected. It allows for the victim to second guess themselves. Well, they did it that time, but it hadn't happened again, so maybe everything's okay. So then the victim lets their guard down and then something else happens. So it is dangerous for so many reasons, which is why when we see something, we must speak up the very first time and say something and not allow it to fester and not allow it to continue, regardless of the time period in between occurrences. So, what are we looking for when we think about red flags? And this is the signs that we can see in the victim. So we see these sudden changes in the way they interact in class, the way they interact with you, or the way they interact with a certain individual. So they may come to class normal and fine, but when this one particular instructor is there, you know that they are shying away from this person, or they are leaving the conversation when this person joins. What are they doing that's different than what it was before? Whereby before they would sit and laugh and talk in this environment with this individual. Now, whenever a certain instructor shows up, this one particular student starts to disappear or walk away, or they remain silent. And there's no interaction and there's no exchange. Are you noticing those behaviors? Not that the student all of a sudden withdraws or starts failing the class, but that their behavior change, whether it's in respect to one individual or the entire class. The isolation, where they are no longer as outgoing or engaging, and they're no longer, yeah, I'm happy to be the group leader. The educator starts to isolate this individual because they need extra time. I need to spend extra time with them because they're just not getting it. But that goes to, are you evaluating them against a standard or your personal preference? But notice and see if one educator, one preceptor is paying unusual attention to a student or always wanting them to get off by themselves so that they can do that one-on-one, so they can have that one-on-one time. Even if that one-on-one time is in a room where everybody is, are they still separating that individual to have that one-on-one conversation? Has a student, even if the student has not verbally expressed being uncomfortable, are they shying away? Do you see like their facial expression? Are they cringing? Are they gritting their teeth? Are they kind of leaning away when this person comes around to touch them? What are they doing, that individual, to let you know that the attention is unwanted? So we have to pay attention to those warning signs and don't doubt yourself. Believe your eyes, believe what you see, and believe what you feel. And if you notice this instructor is happening to rub on the shoulders of this one person a little too often, and they're not doing it to everybody. And even if they are doing it to everybody, doesn't mean it's appropriate. And I'm not saying do not touch your students or that you can't, oh, hi, good to see you, or hug your student or embrace your students. That's not what I'm talking about. I am not saying do not touch your students, but there's appropriate touch, just like there's appropriate touch with the patients. And we talk about the therapeutic touch and the comforting care. So you can touch your students, you can touch your patients as long as it's an appropriate touch and at the right time and under the right circumstances. So we have to be mindful of those personal boundaries. Are they inviting the students over to their house for tutoring instead of to the school's library or in the classroom or in the lab? And is it doing normal operating hours or is it after the building is closed and locked? And they're there with this student to the wee hours of the morning. So watch out for those violations of personal and professional boundaries. And as educators, we must establish a culture to where our students feel safe coming to us, where our educators, our colleagues know that inappropriate behavior will not be tolerated, it will not be accepted. We have to let them know up front that we have zero tolerance for inappropriate behavior with our students. What does your policy say about engaging with students after hours on social media or hanging out with your students, going to dinner with them, going to parties with them? What do our policies say? And we need to take a look and make sure they are consistent with promoting a conducive learning environment, a safe environment. We have to encourage our students to speak up. We have to create that environment where our students feel safe to come and talk to us. And we have to model the appropriate behavior. We have to show positive interaction with our students. We have to show positive interaction with our coworkers. And we have to make it clear these are our standards and we will not deviate, and that we do have a zero tolerance for inappropriate behavior with students. Predatory behavior will not be tolerated. You have to make it clear, but you have to set those standards up front. And it's still not too late. So don't think it's too late to where I've allowed this to go on. So now I can't say nothing. I can't say anything. That's absolutely incorrect. You can always speak up. You can always do the right thing. You can always say that, you know what, moving forward, if I have to sacrifice or if I have to go take an ACLS class or CPR class so that I can maintain my certifications, go take it somewhere else. You have your credentials, go take it somewhere else. Even if it's only been 6 months or a year, go take it somewhere else. So when you report them and they say you show your CPR card to where you got it from somewhere else, so you didn't need that card, although they did put it on the list. So be proactive, but don't allow someone to force you to be complicit in their inappropriate activity. but establish that culture of safety to protect your students, protect yourself. And that's a part of paying it forward. And hopefully, someone will stand up for you or someone you care about when you're not in that space, when you're not in that room. So do the right thing, but establish that culture up front that predatory behavior would not be tolerated. So, how do we prevent it in the classroom, that predatory behavior, is we have to have that open, positive communication. Those channels of communications, we have to let our students know that they can come and talk to us, and we listen to what they have to say. We're not judging them, we're not accusing them. We are listening. We have to let our educators know. You can't go out drinking with your students. Even if you were buddies with them before, you still have to maintain those professional boundaries, even with the language and tone we use in the classroom. When we're in that educator and there are students, there are certain professional boundaries that must take place, and we have to adhere to those standards. Establish them early, stick to them, so that everybody can have a safe working environment, a safe learning environment that's free of harassment, that's free of inappropriate behavior. But when we set the tone early that no, I don't need to be on your roster. I'll take a class later, or I'll teach a class later even. I'll teach it. Don't need on the roster. I'll teach one later. Even if you have to go to a community center or offer it free at your place of worship. Do something to protect yourself, but set the expectations early that you will not tolerate the inappropriate behavior. And be mindful. You have to be on the lookout. Be attentive. Pay attention. Know what's going on in your environment. Know what's going on around you. We can't sit back and just be oblivious to what's going on. Notice those students' interactions with each other as well as with other educators. We have to be mindful. We have to pay attention. Just like safety is a priority when we're in a lab and we're making sure our students are doing things appropriate and right, we also have to be mindful of the behavioral aspect and their interaction with each other. And of course, the longer we're with them, we understand their behaviors a little bit better and we get to know our students a little bit better, and it'll make it easier for us to spot changes in behavior. However, you can see a stranger feel uncomfortable if you're paying attention. So we have to pay attention to our environment and monitor those interactions, whether it's peer to peer or instructor to peer. Those are the things that we have to be mindful of. What about in the clinical settings? We have to ensure that our preceptors are trained. We have to let them know what's expected of them. We also have to let our students know, and we should encourage our students to do evaluations on our preceptors. In my program, it's required. Our students have to do evaluations on the preceptor, just like the preceptors evaluate the students. Because if you have a preceptor that's being inappropriate with students, whether it is if you give me tickets to whatever sporting event, I'll sign you off. I'll give you all fives. Or if it's if you do this for me, I'll do that for you. Or is it I'm tired, don't bother me, don't talk to me. I don't know why they assign these students to me anyway. I don't want to be bothered with you. Don't care what you need. Just leave me alone. We need to know that as well. We also need to know the preceptors that are great, that takes time to educate the students, take advantage of those teachable moments that actually allow the students to interact with patients, allow them to say what they need to say, and then correct them if they misspeak or if they are considering an inappropriate treatment. But we have to foster that environment to where our students know to speak up. Are we doing spot checks in the field? Are we showing up at the station just to talk to our students to see how it's going? The preceptors don't know when you may or may not show up. Maybe they'll be on their best behavior. But if you never come, they don't care. If you do not read the student's evaluation or you do not have your students evaluate the preceptors, then the preceptors feel like they have free reign to treat your students however they want to be treated, appropriate or not. So we have to make sure and we have to empower our students and let our students know that it's okay to speak up. If you see something, if you feel uncomfortable, come to me, talk to me. But we definitely have to train our preceptors, have them understand their role, that their role at that point is a teaching role, is to monitor the students to make sure they're doing things appropriately, is to document, to guide them, allow them to interact with the patients, but also provide that corrective feedback if needed. But they are there to mentor them. We have to do our spot checks to show up, to make sure things are appropriate. But the preceptors have to understand their role. The students have to understand their role because we don't want students to, because there are some students that think they know it all and they don't need to listen to anyone. And we shouldn't engage, we shouldn't allow that from our students either, but let them know you're there to listen. It doesn't matter that you're an EMT and you're in AEMT school. It doesn't matter that you're an AMT and you're in paramedic school. You're studying to be a paramedic. You do not know everything. So you're not there to argue. Yes, it's okay to speak up, but be mindful in the manner in which you do it. But you also have to be willing to listen and learn because you do not know everything. So empower your students to speak up, empower them to advocate for themselves, to say that this is not right. Don't touch me. And let the students know that if they speak up against inappropriate behavior, they will not be retaliated against, that you will be there to support them. If they call you and tell you that somebody is treating them inappropriately, whether it's endless questions about their ethnicity, rather it is endless questions about their personal life, rather it, regardless of what it is, or challenging their knowledge on everything rather than educating them, teaching them, coaching them, it's a challenge. Well, do you know this or do you know that? Or what do you know about this versus tell me what you know about a complicated childbirth or tell me what you know about a STEMI versus challenging and questioning and not wanting to be there. So we have to let our students know, and this should be a part of our day one orientation. And school's getting ready to start up in January for many. And part of our orientation should be boundaries. This is what you should expect in this classroom. This is what you should expect in the lab. This is what you should expect in the field from your field preceptors. We have to educate our students and let them know that it's okay to speak up for themselves, but we also have to provide them with means of support, whether it is our contact information for after hours. And it doesn't have to be your personal phone number. It can be an app to where it's tracked, to where everything that's printed in there is documented. So there are many different ways we can provide support. We can provide support to hotlines. There are a lot of different things we can do, but our students need to have somebody when they're out on clinicals, somebody affiliated with your program that they can reach out to. Some hospitals require preceptors to be in the hospital with them when they're doing their ER clinicals or not, but your students should always have a point of contact when they're on clinicals, somebody they can reach out to. In the classroom, in the lab, there should be someone that they can reach out to say, hey, this is not right. I don't feel comfortable in this environment. And we have to provide them with the support that they need, not to shut them down, not to victim blame, but to listen. And when we listen, because a student has come to us and say, hey, this happened, I told them to stop, I wasn't comfortable, or whatever the situation is, that we listen. Before we jump to conclusions, before we take one person's word for it and run with it, listen. Listen, we can provide reassuring comments, but listen to the student, take in what they say, document what the student reported, not what you think, not how you feel, but what the student stated to you. Treat it seriously, pass it up the chain of command. If it's a Title IX violation, if it's a student to where we're mandatory reporters, whatever the situation is, document it and report it appropriately up the chain of command. And even if you give a verbal report, always follow up with the paper report because we have to, we must, we absolutely must document to protect ourselves as well as the victim. But verbal, follow up with the email because if we didn't document it, we know what that means, right? And this quote from Martin Luther King Jr., and this is so true and so profound because the words of your enemies are not as important because oftentimes, what do? We shake it off, or they were a jerk, they were this, they were that. I don't care about them anyway, right? So it's not the words of our enemies, but the silence of our friends. When you need someone and they don't stand up for you, when you need someone and they don't speak up for you, when your students look to you, who do they see? When your children look to you, who do they see? Your parents, your friends and family. When anyone that you say you care about, when they look at you, what do they see? Can they count on you? Can they count on you to speak up for them, your students? We should always be advocating for our students. We should always be speaking up for our students because we would want someone to speak up for us if we were in a vulnerable situation. We would want someone with some authority to say something, to do something, to intervene on our behalf. Now, and don't think of yourself as to where you are now. If you're saying, well, I'll speak up, I don't have a problem, and I'll do this and I'll do that, that's where you are now. Think about your first job. Think about when you're in class, even if you want to go back to third grade. How vocal were you? How confident were you to speak up? Or the individual that this is their first job and they have to take care of others. Their parents are sick and they've lost their job and now they have to go to work. How comfortable are they going to be able to speak up? How comfortable are they that they can speak up and still keep their job? So ask yourself this question: who is counting on you and who can count on you? Because when you speak up, you're not just doing it for the individuals that are in front of you. You're doing it for those that are coming after you, behind you, those that you will never see. So when you speak up, it's not just for those in front of you. You're speaking up for the individuals that don't feel as if they can speak up for themselves or those that don't have a voice for themselves. That's who you're speaking up for, not just those in your presence. So who is counting on you and who can count on you? And what can they count on you for? Can they count on you to be that voice, to be that protector? Think about those that are counting on you that need you to stand up for them. Advocate for your students. You are a leader. You are the authority. Speak up. Even if you're an adjunct instructor, speak up. Even if it is the program director or the lead instructor, speak up. Know the chain of command within your organization. Know where your Title IX officer is, your ADA compliance officer is. Are they located in HR? Do you have an outside legal department that you go to? Know the chain of command, know the proper reporting procedures. So when it happens, you're not finding out then, well, what do I need to do? And who do I need to go to, which delays the reporting because we have to protect the victim. So we need to know the chain of command. So know it now. And if you don't know it now, look it up when you get back to your office. Look up that chain of command and know what the reporting procedures are. Know when you have to report it internally and or externally. Know the proper procedures and know who to go to. And again, if you go verbally, follow up with the email. This is what was said. This is what was discussed, because you have to protect yourself. We can't be afraid to speak up, just like we can't be afraid to do CPR. And there is the Good Samaritan law. So if you do CPR, if you step in to help somebody, so you're protected, right? You don't want to falsely accuse anybody, but you can't let inappropriate behavior go unchecked. So when do you contact the authorities? Follow your procedures as far as proper reporting. And it also depends on what the allegation is and what you witnessed yourself and what happened. So all of those factors are going to play a part. So there's no cut and dry answer, but our internal policies and procedures should tell us when to contact, when to avoid the when to contact the outside authorities, when to involve them, when to reach out to them directly, or when to follow the internal procedures. But if you witness a criminal act, that's criminal. So do what you know is in the best interest of the victim, those that you should be protecting. Do what's in the best interest of you. And that's speaking up and speaking out and not, well, I don't want to be targeted now. No, speak up, use your voice. You're in a position of authority. You are a mandatory reporter. Report it. Report it properly, follow procedures, but report it and not leave the victim high and dry by themselves. We have to speak up. And it's very important that when someone comes to us to report an incident, that we maintain confidentiality, that we only reveal the information to those that have a need to know. We have to make sure we do not isolate the victim, that we do not investigate ourselves. We have people to investigate. That's why we need to report it. But we have to maintain that confidentiality and make sure that our reporting is done in an appropriate manner. And even if we're having discussions, that those discussions are being provided in an environment that is safe. And we have to provide emotional and psychological support, whether we refer them to outside resources. Sometimes it's just a hug or a comforting touch. We have to make sure that we protect the victims, that one, we are not witnessing retaliation, that we're not engaging in retaliation, that we are protecting the victim, and that it's not a one and done, that we continue to monitor the situation and keep a watchful eye, regardless of the outcome of the investigation, that we are monitoring what's going on, even peer to peer, because you reported on my favorite instructor. So now I'm going to be nasty to you, that we do not tolerate that behavior in our classroom at all, regardless of who it's coming from or what the talk was, the complaint, who the complaint was made against. Because oftentimes people, whether it's educators or students, they want to protect their friends and now they want to target the person that reported them. So we need to keep that watchful eye. In this particular case, where sexual abuse charges were filed against an EMT instructor, there were 13 counts. 13 counts, because this person was in a position of trust. They were a paramedic instructor, they were a firefighter, and they preyed on their students, and they were charged with 13 counts because they misused their position of trust and they preyed on those that they should have been protecting. Forcible sexual abuse, 11 counts, 2 counts of attempted sexual abuse. And the victims, when they did come out, this is what they said. They feared retaliation. They thought that they would fail the class, that their grades would be changed. And that's why they delayed reporting. And some said they didn't report because of the fear of retaliation and grade manipulation, but they also wasn't comfortable and they just didn't know what was going to happen. And they also thought that since they didn't report it the first time, that nobody would believe them or that they would be blamed as if it were their fault. Now, the I key, which is we interrupt and we ask for clarity. Wait, what did you say? What did you mean by that? Explain to me the why. Explain to me, provide me a little bit more detail so I can understand what you mean when you say X, Y, and Z. And then I need to know a little bit more. I'm not familiar with that, but just explain to me a little bit more. And if we use say, I need clarification, I need understanding, then you're not victim blaming. You're asking for additional information and more information. And then apologizing doesn't mean that you're accepting responsibility. I am sorry that happened to you. I'm sorry you're going through that. And I understand that this must be very difficult for you. Thank you for reporting this to me. Thank you for coming to me and sharing this. And we can't blame, we have to resist the temptation to blame or to take action, but to listen and not share our own words or this is what I think or this is how I feel. We have to hold back from that, but we definitely have to report when we see inappropriate behavior. And Dr. Tripp she's at UPMC, which is in Pittsburgh, and there's a lot of information, and they actually offer a class on this. Don't know the cost, but this is a resource that we can use. And again, it can be student to student, educator to student, guardian to educators, because sometimes parents of students offer favors to get their child a pass. It could be a chief officer offering a favor to the instructor, you'll get promoted. So it can go in various ways. And it can also be when our students are doing their clinical rides, and it's just not the provider to the patient, it can be patient to our students. They can think that they're young and cute or handsome and they want to explore options with them. So be mindful of that and understand, be open minded, and know that it can go in so many different directions and not just what we normally think of. But when we have these case studies and these scenarios for discussion, we need to have a discussion after the fact. We need to identify these red flags. And when can we step in to prevent this behavior? How do we respond? What's the best way for us to respond? But our scenarios have to be realistic EMS situations that EMS educators find themselves in, as well as our students find themselves in. We need to create these real life situations, present them at your next faculty meeting. What would you do if? Create the scenarios for your students to engage in. We have to recognize the behaviors early. We have to create that safe environment, that culture, breed that culture, foster that culture to where we're going to protect our students, that I'm watching and I'm not going to be quiet. So you can't bribe me, you can't threaten me because I'm not going to allow you to, I'm not going to tolerate you abusing a student. And we need to know our protocols and follow our protocols, but also make sure that our protocols are clear. Know what hotlines are available, support systems within your institutions. Follow your procedures when it's as it comes to reporting. Report it, document it. Attend webinars like this. Consult the literature, read up on it. Adhere to the code of conduct. Our professional organizations, whether it's NAEMSE, NAEMT, NAEMSP, COA, our organizations have code of conducts or code of ethics. Post them in your rooms. Hold your educators accountable, but attend information sessions, attend webinars, read up on it, read up on new trends so you'll be mindful and you'll be more enlightened and be able to help your students, advocate for your students, but also recognize predatory behaviors and speak out and know additional resources, local and national, to send your students and refer your students to. And with that, Rio, do we have any questions in the chat?
I don't see any questions yet.
So if you have questions, feel free to ask. What's on the screen is a QR code with my contact information. So feel free to contact me, follow, like, social media. I have to do better on updating my social media and chatting, but I will. But that's my information. Feel free to call me, email me. I definitely respond. And thank you again for attending. And I am glad that you joined us. And thank you for attending this webinar. And Rio, do you have anything else if there are no questions before we close out?
No, I just put the link in the chat for the CE. Looks like lots of praise to you in the chat, but no questions. So I think we're
All
good.
right. All right. Thank you all very much. Have a wonderful day. And remember, it's okay to speak up. Stand up, challenge what you see that's inappropriate, and use your voice for good. Thank you very much and have a wonderful day and happy and safe holidays to everyone.
Thank you so much, Carlene. Much appreciated. Bye, everybody.